Justin.
Justin.
She's like ever so slightly blinky. A little bit. So I didn't know if you wanted to see her before we roll it.
It's pretty minimal. I would say put the thing down and
We're gonna roll her on it.
roll her, and then reevaluate.
Okay.
You might have to give her another minute or two, but
These are upper people that are coming here for this. Just a couple just to roll her.
Yeah. Lauren, Jordan. Lauren and Jordan. Alright, hey everybody, this is Big Cat Rescue here in Tampa, Florida, and this is Kali Tiger. She has been sedated for a medical exam and a dental procedure.
Alright, so yes. Up here you'll be fine over here. Just grab like the shoulder blade area.
yeah. Pretty minimal. I think you could slide her in there.
Okay. Other people coming to pick up?
Really? Yeah.
Alright guys, so Kali Tiger here at Big Cat Rescue, she's 21 years old. She is experiencing some dental issues with a broken canine. So Jamie has the Y stick controlling her head. And all of our interns and our coordinator today is Lauren Grant. Very heavy.
Take the weight of it and guide it down.
Go ahead. There you go. Perfect. Alright. So, again, Kali arrived in 2015, and she's actually been such a healthy girl. She's never actually had a vet exam here. Here recently she has started showing her age a bit. We noticed a broken canine. We know that she needs her nails trimmed, so we are going to be giving her a full-blown exam today. We've got Dr. Justin and Dr. Gingerich.
We need 4 people to help raise the basket this year. There you go, not a corner.
Alright, so we are going to head back out to the carts. Hopefully my cart continues to work. It's been spotty. I'm like, this is the wrong day for that.
Somebody pull from this side? Yep. Once it starts going, it's easier to steer. Yeah. Lock out?
Yep, just let you lock out and watch your pole. So we will get her up front. We will be getting a weight on Kali. So Dr. Gingerich is here for her dental work. Dr. Justin is here for her full physical exam. I will try to stay live with you guys as long as I can and for as long as I have a charge on my phone. You can also watch on the Explore cameras in the hospital at bigcatcams.com.
All right, everybody up to the hospital, please. Grab that.
see if I can make it. Yay! It started. I really was questioning it. Might be the last stop I make. Here's Simba Tiger watching Khalid. He was very, very interested in what Khalid was doing today. So again, Khalid Tiger, Big Cat Rescue here in Tampa, Florida. Thank you guys very much, everybody who's sharing this. Make sure you tag each other, help each other out in the comments. I try not to do a ton of talking during our medical lives because I want you guys to hear what the doctors are saying. They don't need an extra voice in there, especially with a tiger and a tiger dental. There's a lot to be looked at today with Khalid being 21, almost 22. If you consider her in human years, times her age by 6, and that's roughly what it's like to be a 21-year-old tiger. We're gonna pass by Coda. I'm sure she's not gonna love hearing that transport sound since she just got here a couple of weeks ago. Let's see if you guys see her. Yep, all the way in that back corner, ducked down. You guys can sponsor Khalid and help out with all of her medical costs. This is going to be a very pricey day for her, but she's worth every penny of it. So you can do that at bigcatrescue.biz and find sponsorship kits, find the tigers, and you can choose Khalid. Always very nerve-wracking to sedate any animal, but especially one that is of her age. So thank you guys for all the well wishes. And again, you guys can watch this from a different angle on our Explore cameras. If we do any x-rays, we have a camera in the x-ray room as well. You can find that at bigcatcams.com. And you can scroll down and you'll see the Windsong Memorial Hospital and the x-ray room there. How many cats have you been here for us before? I'm with Dr. Gingerich. She's on my golf cart here. Do you remember the first cat that you?
I know we've probably done 10 or 12.
Yeah. Has it mostly been tigers? Or?
Well, we did Cameron.
Oh, that's right.
I've done a bobcat. I've done at least one. I think it was a leopard.
Okay.
And then.
Oh yeah, Jinx. Black leopard? Yeah. Okay. Yeah.
And then a bunch of tigers.
Well, I'll have you know, I lecture Jinx all the time. His favorite thing to do is chew on tree stumps. Yeah. And I'm like, you had so much dental work, sir. Please stop doing that.
Yeah. Tree stump to do it.
Oh, he does it constantly, and it's to show off and be playful. And I'm like, no.
Maybe with the root canals, he doesn't feel this.
He does not. He does not.
I don't think, again, going back to 2015, I was doing 2 or 3 trips a year.
Yeah.
Yeah, you would do 2 to 3 each time.
Right, yeah, definitely. There are stuff. Gonna get a weight on this girl. Yes, they're rolling her up right now. So, yep. I'm good on my side. Good done.
Do you want to catch the weight for me?
All hands off? Yeah. 12, it's still fluctuating. 1276.
Okay.
So we'll have to do some math and take out the weight of the transport cage. 1276. Yeah.
There's certain parts.
There we go. Do we need this one open? Do we need this for people's sake?
That's already done. We're just thinking of your road.
Yeah.
Readjust the top. I think we just. Okay. Can you get the white stick off in the golf cart? And then we're gonna need more people in here to help. So. Pass and handles.
Alright, so we are gonna get Kali Tiger onto the exam table. I'm not gonna do a whole lot of narrating. I want you guys to just help each other out in the comments and try to listen to what the doctors are saying. So again, Dr. Gingerich is here for dental. Dr. Justin is here for the full exam. He brought an awesome tech with him from the Humane Society. We're gonna get her intubated and get her nice and settled.
The brakes. That place should move. Drop this down one more time.
Yep. Okay. Roll it back a little.
Try to get it more centered in the room. You want them in? They can come in right now. You need to shut the door. Alright, put those brakes on down there. Just make sure. Just, yeah, so.
That's fine for me right now, but what about you?
Just watch this step.
Little higher, you think, Mike? Or
Yeah,
You want a chair?
I thought the stand Stop right there.
We're gonna have to have people help roll her in her back. You two stay.
I just did the big one. I don't know for sure.
What are you over here? We're gonna pull my way.
What?
We're gonna push.
No.
She's gonna open it and run it.
Yeah, I mean, that's surprising. She's pretty good. So, huge.
She'll let her go up this side. Nope, the other. Just put your hip on the
You can
table
really see
and
that.
just give her a hug.
Like the cat.
Oh, yeah.
You can get a really good look right at it, straight shot. Tried to convince the anesthesiologist that you have to try it. They want
Remember I told you about the zoo experience where she had her whole arm down?
Yeah, they do.
Feeling that?
Yeah.
Alright, back on her side.
It's just like there's no need. No, I mean, it was a straight shot. Yeah. And like a place like, you know, most, they put it up pretty high, like 6 maybe.
You got this up?
Put the ISO on 2, yeah.
Where's your pulse on?
This is around the table.
This is from,
Okay.
this is from the balls and.
Probably, yeah, she plays with them a lot.
Yeah. It looks like she really hits the palm on her left.
So how much do we?
$12.76. Yeah, I don't know what the transport was to do the math,
Yeah.
but
It's a
I didn't hear
non-PCR,
it.
so minus
Right.
1102.
This is the best way I've been able to breathe for
Oh,
them.
that can't be right.
is I close the
It
pop
has to
off,
be with
and then
BC.
my knee and my
There's
hand.
no way. She weighs
Count the breath. You hear a lot of noise.
I feel it was
Yeah.
that. I don't think
Yeah,
that's
because it's just
she's
like
swallowing
rushing
again.
through. Yeah. No, I think she's pretty good.
This
Pretty out of
is
it. She
even
looks
if
pink.
we use the not
Yeah,
the
okay.
smaller weighted one.
Stable.
Is that the one? Did you check it?
No, it's just the impossible the other one.
Yeah, if you can.
1,100 pounds.
And then I'll try to put in a catheter.
Yep.
I don't see how that one's that light. We don't know. To weigh them again.
Might have to.
Because it should be like.
No, she's in there. I can double check that.
Looks like that. Little tube.
Incisor.
Yeah.
Mm-hmm.
Oh,
Bunch of incisors.
oh baby.
Extracted
How's
some
that
of
one?
those before. It's close. Smooth.
is it? Okay.
Yeah, it's the BC one.
So 400 pounds, Justin.
400 pounds? Oh, that's why she didn't go down right away.
Lady.
So
Okay,
300,
well,
but then I
that's
gave her
the end
enough
of
for
questioning
about
whether it's
400.
Kali or Duchess is the biggest tiger.
How much was it?
Afton said she thought she was around
Did we weigh?
325.
No.
No, we did that decision not to.
Yeah.
Only because I'm noticing her pancreas is a knee. Big bone.
She very big lady.
Yeah.
Jamie, where can I connect this?
That one or two, sure.
There's
You can
the
use this,
big,
the-
yeah,
yeah.
the big one there. I'm gonna stay back while they're doing their initial exam. I don't want to be in the way, but I'll try to get you guys some close-ups.
Well, yeah, I mean, it's a big tooth. It
So
definitely
she
needs
was
your
400 even, is that what she said?
Yeah.
Let's get some gauze.
Do you need gauze?
Yes. Gauze,
Do you have bleach? Because I brought drug over.
yeah, I'll take some more. I have a little bit to start.
Maybe
I definitely will use more.
Okay.
And at some point, we gotta get the X-ray.
Oh, yeah, scan it.
Nothing's going.
Oh, our thing?
Yeah. And that dental unit.
That's the best place to place them.
Was that?
Yeah. Is it not working?
Do you have alcohol?
Yeah.
Yeah, I'll put alcohol.
Yeah.
Yes. Sure.
Is it not working?
Yeah.
You try it.
Trying to put it somewhere else. Just because he'll be working up there. Up there somewhere.
You try an ear?
I will. We'll see how long that lasts.
He busted himself.
Is that your headset, Justin?
Yeah.
Did you tell her you got it to work?
Yeah, it worked at the end after you left.
He's like, yeah, to look at here. He like tried it out.
Or some, I'm
What's
gonna
up?
shake the tip of the cap.
Yeah. Do you have tape or anything?
I think everything's over here from the last time I remember.
There's a bunch of stuff over there, but I got tape over
Yeah,
there.
there's
so.
yeah.
Do you need blood on her or anything?
Besides the inside,
yeah,
all the
you
back
pull
teeth
some
look
blood.
okay?
Yeah, the premolars, molars look great.
Okay, 'cause she was on the chart for chewing, so now we
Was she?
haven't removed that.
This is coming from those balls, it looks like. Yeah, those big
Aw.
plastic balls, if I had to guess. You see the angle on them?
Mm-hmm.
So it's like, just rising, they're smooth.
That's literally her favorite thing to do.
I know,
It
they
really
love
is.
They
But
do
this,
love
this one's exposed, right?
This one, yeah, 304 is exposed. None of the lowers look exposed. 103, it looks fine. This one's kind of weird.
Looks like it should be, but
Yeah.
yeah. I heard it.
Yeah, I'll be able to see that better too.
And then that 3 looks exposed from here.
Get the mag on, I can see something.
Yeah, they're underneath.
Not good light. Yeah, 203. 201 is fine. 102 is not fine. That would be a pretty easy extraction. This we could.
You guys would like to see the setup that Dr. Gingerich comes with.
What's that?
The blue bowls, there's just one.
No, there should be a whole stack of them, just to the left,
She has a
underneath
little
the
bit of
outer
cage.
thing.
Maybe abrasion on the back, on the distal abrasion. Cage there, still here. Don't see as much of it. Bruce.
Shouldn't chew in the cage.
These premolars are fine. These premolars. Put it back down.
You tried?
Okay. So we should block then middle mental, infraorbital, orbital.
What's this side for? The,
This one.
Oh,
right there.
this.
Yeah, I mean, we don't have to block it, but.
no.
Did you take
It'll help you.
I would do anything else I didn't want to go over, right?
Just me.
So, does she,
I have Barbicane, I think.
What is that? Is that, got methamphetamine?
It's like, it's kind of like Barbicane.
Yeah. Have you used it for blocks before?
Yes, yeah.
Okay.
Did you want to look in her eyes
It's
before they get moved?
Barbicane.
Methamphetamine, yeah. That's fine.
You want to look in her eyes?
I'm gonna
before
look
they
for
get-
eyes.
Yeah. No, wait, don't leave me yet.
No.
No,
I don't wanna look at theirs.
4%.
I'm gonna leave it right here so you can look at them. Okay.
I'll give you this in the meantime.
She's 21
Use it
now.
off, then
And
we'll
then
put
she's
the
21
fingers
now,
out.
yeah.
Keep the sleeve and put it
On
right
back
in
order
the-
for like,
I lost that sleeve about that yesterday. Oh, no,
yeah,
that's all.
it's easier to get it.
He was like, what is this?
She on meds?
No, just, Costco.
93.6.
How many kicks is she in?
She would be at 400. She's gonna be like 180. Let me calculate it real quick.
I can take that from you when you're done.
Card.
I could do, you think maybe
She what?
CC a block, that'd be 20.
Yeah.
Oh,
right?
Yeah,
Yeah.
definitely.
20 minutes,
Did we see the
20
one yet?
milligrams each block.
Yeah, it's
So 60 milligrams
You're
total.
fine.
That's looking
Yeah.
easy. It's really close, but I can put my finger in there.
Just want to make sure.
in domestics, it's
I don't
like,
use
I
it.
think I
Oh,
I
yeah,
mean,
that
in
one's just
domestic
about as
cat,
close.
we usually get away with
barely the time I
Carbocaine,
finger
that's
underneath
like,
it.
Yeah.
Laura, domestic
Yeah,
cat,
that
we
one.
usually
She's,
get away with Carbocaine, isn't it like
She likes
0.2?
to use them.
For a domestic cat, I usually use
They're
like
all
0.3,
blunt.
4.
Like
The
3/4,
ball.
Yeah, it's the ball. Her back ones, I think, are going to be more ingrown looking. I think it's just the
Yeah, all these are, shaved down from ball playing.
it's the dews
The
that
dew.
have it, yeah, big time. And then the back are probably worse.
Nothing close to like hurting her, just those dew claws. But it wouldn't hurt to trim these since we don't want to do this again.
Staying pretty active for a 21-year-old girl.
Yeah, those.
I know, that's not, because at first I was like, she doesn't even have a claw.
Or so far, you know.
Yeah.
Oh.
While she's doing the catheter, it's nice to have a session, have a computer.
That's a much easier. I don't know what to again.
Oh, yeah.
Is your text box?
Yeah.
Yeah. Sitting away.
Denise.
Yeah.
Sure.
Sorry, I'm mixing.
Yeah.
How much fluids do you want her to get at? Or she can get through there? Or?
She can get some through that, yeah. If she gets it.
Yeah,
The
two
pressure,
bags
the
of
pressure.
lungs on it and one without.
I haven't been pointing the camera at her, so I was hoping that'd be helpful.
What size?
18. Should we go for 22 or 20? Do you have 20?
Maybe a 20. It's kind of been one of those things I've noticed that I always struggle with the larger bore catheters. Like, you look at the vein, you're like, that's a 16 all day long.
Yeah.
You know, like, and you just fail.
Yeah. Exactly. This is that plastic.
Is it?
Oh yeah. When that bulge coming out.
No way.
See it? It's like a bluish, greenish blue.
It was a green ball.
Stop, really? You're finding it in there?
Oh yeah.
I'll look and see my 20.
Oh my gosh.
Yeah.
Lady.
For the ones that are really,
Oh, right.
they're really aggressive with it.
She gets jealous?
She gets
when
jealous of the
other-
neighbors eating before her.
Yeah,
Does she?
so she attacks her ball.
It's her.
Oh, she takes it out on the ball.
Yeah,
Yikes.
That's her deal.
Oh no.
yeah.
Baby girl.
Yeah, I know.
Your jealousy caused you some dental issues.
Uh-huh.
Oh, honey.
Maybe in her new spot she won't get as jealous because she won't see so many things happening past her.
I haven't seen her
The only
do
cat
much.
she watches eat is, it would be a turtle, but it gets
Yeah.
fed last. Like after her.
Oh. Yeah, of course.
It's crazy.
That is crazy.
Oh, yeah, yeah, yeah.
Well, she's been moved out of that enclosure, so she doesn't actually have that ball anymore, but still.
The red yellow now.
Yeah, the red, the topsy-turvy.
I'm afraid X-ray's ready to go.
Jamie's the expert at that thing. I've never turned that one on. We were talking about the other day, we don't use it enough, like, we like forget.
And it's progeny, so we're running, you run both systems on it. You have a sensor too?
We have sensor too, yeah.
You run the progeny sensor and the statics on it.
Does he get angry when you do that?
Alright, so we're gonna do some dental
I mean, it's
x-rays,
nice you're able to
really
do
see
that.
what we're getting into here.
That progeny is so slow. I don't know if it's from this computer or whatnot, but.
I think the plan adjusting is too bad. It's gonna be so easy.
Yeah.
This would be a lot more difficult since it's right there. You know, I don't think it's gonna increase my time a whole lot.
I'd be curious to know what that number 3 is when you root canal, and if you think you feel it as much as a dog canal.
Yeah, here's that stuff coming through. So.
Oh, yeah. Oh, my camera needs a second.
I saw a little bit of pink something.
Yeah, mine there's some pink in there. There was some more of that greenish. You can kind of feel that the way it catches, it has a feel like it's something plastic or rubber-like.
So you can feel the difference versus like an empty canal.
Yeah. For
So
sure.
any of that dusty stuff, tooth or it's ball? That's kinda
Mostly ball.
Okay.
And there's other debris. You know, there's sand and dirt and stuff she's eaten, other things she's chewed on. But I know when I was getting that color, see there's some dirt right there. That's just sand. But that greenish color stuff, that was definitely that ball material. Start getting some flush in there. Ready to go?
I think she saved it for one cat. I think it might
Got
be
it all the
here.
way up. Full second. It's gonna need a full second. I'm gonna do the side reach first. Yeah, that'll be the highest it'll go. Just hold it down.
We have one cat that I think.
No,
Oh,
all
oh,
the
okay,
way.
0.6, I
Yeah,
see.
you'll see it go all the way to 1. That's where it stops.
Okay.
I think it might have been Pete when he came out here and did a root canal. That he got like a twisty.
Yes, I have that somewhere.
Yeah, I know. I thought you did. Got like a whole twisty piece of a ball.
Oh my
Like
goodness.
a spiral, like
Yeah.
it just shaved off into the canal, and it came out like it's like a whole curly Q.
Yes. It's gonna be tricky.
Oh, lady.
I almost feel like I could shoot these backwards.
It's long. I'm gonna make it.
I'm gonna come around where you guys are.
What do you use for that?
I'm gonna shoot just on
Good
there.
head. Let me,
I did the same thing over there. I was like,
It's got a cool down. Every time you shoot full second, it has to go through a cool down.
Okay.
It's like, that's a lot.
maybe pull some blood first. Give her a second. Don't try another one yet.
Oh, there you go. That's not too bad.
Yeah, and I think you
It's always
can
a
adjust it, yeah.
You can probably pull blood from your bladder.
Yeah. Or reverse her.
That's it for now. Let's do this. Let's just see what we got. Cut back around.
Yeah, bladder was better than, medium better than mine. How much blood do you want? 3 cc's or 5 cc's?
There's no reason. We don't need to send any out, right?
She's never had blood work, so I don't know if you want like the FIV stuff or.
Yeah, it might be a good idea to just pull like 5 cc so we could send out a red, black, and purple. And all we need here is a purple and
You want
a
to do grade
green.
2? Both?
Yeah, we should probably do some now, right?
Yeah,
Okay.
just so we know where it's at. Oh, she broke that one.
Yeah, that little one's perfect.
Do you need Bluetooth?
I'm gonna throw these in for now, but
Oh,
at some
sure.
point.
Yeah, I got
Yeah.
it.
Because I don't want to start throwing. See what I got there.
Do 2 purples then?
I can see it now. There. See that?
Hey, Justin.
Coming out of Apex is gonna be over here, but that's. I'll keep filing.
Yeah,
see
the
if that-
setting's a little off.
Yeah.
You can see a little bit.
that one seems so unhappy.
Is that enough?
I don't know, it used to take really good, so I feel like
It's like a setting.
yeah, the settings
It's a
remember
filter.
the next time.
It's a filter.
You think so?
Yeah, 'cause there's different, with any software, you can set different filters.
Mm-hmm.
And you may have some presets. A lot of times, if you're toggling back and forth between the sensor and that, and the ScanX, then you just have 2 presets. One for each one, you know?
I wouldn't even know where those are.
Well, these are in something else other than project.
Oh, this isn't Project. This is
So
something
they-
else.
Everything you have?
This is the easy view.
Oh, okay.
And
Well,
then once
maybe
we
that's set
select
up.
them, it goes over the project names.
Okay. So then it should be set up, maybe the filters got
So.
changed in there.
No reason
Here.
to.
There are huge differences when I change these. Like,
Yep,
you really
and I can
don't
get
know
it set up.
I just drove the scroll
So,
bar.
and then you take a couple. So those are for you, and then this one is to send out.
Boorstein, you got a catheter.
Thank you.
Got a catheter on?
I reversed. So.
She gets raised, no?
Yay.
Oh,
Oops, sorry.
Oh, okay, it's not my skills, it's just because you're reversed.
Yeah, well, then I think that falls as my skill, right? Do I get the credit?
Let me just get one. One, anytime.
Did you see that paper it came out about using lidocaine to reverse the Dexmed bradycardia?
No.
And yeah, and then the anesthesiologist I worked with, he said it just makes it dilate and you get rid of
Really?
that lidocaine.
Huh.
Yep.
How do you want me to take
I
that?
don't know if you want to do that in cat, but
I know.
You want me to take it all along the line?
Yeah, you probably take it around like. You shouldn't have to split it.
No.
I mean, don't think changes because I did it first,
Pretty big one.
but.
Are you making a list?
Did you already have one?
Well, I started one.
Oh, okay.
So you can, I was like, I better do this now because I'll be one-handed later and wouldn't be able to get to it. But you can, yeah, add whomever. But I got all the ones, like, volunteers the list for,
Okay.
as a favorite. So that's on there for sure.
Okay.
So thank you guys again to everybody who is helping each other out in the comments, explaining what it is that you guys are witnessing here.
Do you want a bolus or anything? Or just,
Right,
have
you
it on
just-
fluids? It's only a 22. I mean a 20, so keep that in mind.
You could probably just open the bag. See how fast it's going.
Tiny English catheter. This is what I usually put in normal cats.
I know. Wait till everyone knows. Everyone on Facebook knows.
Yeah, everyone on Facebook knows. So if you guys are just joining us, Kali is having her very first exam here at Big Cat Rescue. She was rescued in 2015, but has been a very healthy girl.
Too close, that need to be cut.
Do they need, yeah, I have nippers. If you wanna cut 'em.
Oh.
Yeah, they're like nubs. Yeah, she uses them.
I need the.
Horse ones? I thought
Yeah.
these were too big, but you could.
Yeah, I need that.
Might as well be grabbed up.
She is gonna get a nail trim. We're running blood work. I know that.
Doesn't matter. The new one?
They're all for her, so whatever you need to use.
There you go.
She's
Look at
gonna
that.
get fluids. She's getting dental.
Let's fix it.
This filter right
Yeah,
there.
I hit filter.
Okay.
I just started.
That looks way nicer.
Yeah.
Adjusted the
You can
thing.
see like the texture.
Yeah, I just started flicking filters.
Leave it to a professional.
All hard.
Yeah, it's really only like her dew claws that seem like
Yeah.
they're close. She uses the heck out of
Shoot
them.
candy
It's
gun.
crazy.
Yeah, I'm gonna
You
eat
just
about the
come
shoot.
on, yeah.
Shoot.
Superpowers.
That would be too light. We have another one. You can run this. That's gonna be too light. It went back to the original setting. Gotta have a full second.
So playing ball is in trouble.
I
That's what her video's going back. Playing ball gets you in trouble.
Set this down. That's okay. I'm just doing it because it's quick.
Do you want another plate or what do you?
Just run. Go ahead and run that one. Let's see what we get.
And we need you
Yes.
to hold that nail out.
Yep.
And we'll see how thin I can, how much I can take off without.
Very sheathy.
Yeah. We can knock off some more sheet down there. Yeah. Close it in.
Yeah, see the.
Come on.
Like you can half crack on the sides and see where it's like.
Oh, that's the one. Right there.
I'm afraid to. Is it?
Because it'll go
Has a
back, like you can always
catheter, so
click
she's
back
gonna be
on
getting
the-
a lot of fluids.
Oh.
Trench or
I just like that.
take much more. Let me see if I can
On the other side, or one of them's like up.
get low.
Like it's like, oh, move it around. Yeah. It's good though.
Oh, bless her.
Oh, there you go. I was like afraid to take it off. I'm like, wait, she's sleeping. You.
Be a little angry.
Oh, that's not horrible.
Oh, yeah. That didn't end up as bad as I thought.
No, it's just like it's like the sheet that's been there for so long.
Yeah. Has a blood supply.
Good job, lady.
I don't know if we can get this one easily. We might have to.
Let me know if we're messing you up.
Okay, you're fine.
Oh, it's really close. There you go.
David, can you lay those films? a towel?
A towel?
Yeah. Prop something. I want to see if I can shoot an extra oral. It'd be a lot easier.
Oh, yeah. That probably would be much easier, wouldn't it?
Yeah, I mean, if it'll work.
Here, I'm gonna focus for a second.
Just like bounce it a little.
Yeah. See if I can-
You know? Which one are we looking at? This.
Watch out, he's gonna
Oh, right now.
shoot.
I want to see where this thing stop. Might not be able to get close enough to it. That's gonna be too long. Let's see. Might be too light. It's still hard to-
I'm ready for those slides.
Like when I
Yep.
come down, Justin just, boom.
It just ends.
Oh, it's just like there's, and I'm not even near the length
What
of
are you
this
doing?
thing, you know what I mean? So I know
Oh,
there's
not
either
these
mineralization
We will
or
need these
something.
then.
We got caught down there.
Oh, yeah.
Really?
And, you know, we do need to make an access, so I can do that now. But I kind of wanted to get down as far as I could with the coronal.
Yeah, because how far is that? Put that next to the.
Oh, this is 32. This is my working length on this size of it. Using that other file system.
Wow.
So that's an incisor. You know, this thing is way out.
And it should bend a little, correct?
Oh
You
yeah,
should
as it
follow
goes
that.
down, it's gonna bend. And I did, you know, just to see if I could catch, you know, pre-bend it a little bit.
Like if you were hitting the edge.
Exactly.
Yeah.
Like, you know, can I slip past it? But no matter where I hit, it's just. What does that look like?
Like the mountains.
Yeah, I get closer. All right, let me take another one. Go back to the standard thing.
Thinking it was too much drop.
Yeah, you know, because as you back away distance, you're losing.
We do
No,
all,
power.
so there's
Yes,
estimates we
yeah,
can
big
use.
time. The closer you are, the more power you're gonna have. You wanna shoot it, Justin?
Yeah.
Thing is my instructions up here, I don't even need the whole route, you know what I mean?
Yeah.
So, something like that, got it?
Yep.
Full second, so it's gonna take a while. Yep. Let's see,
That one look okay?
Yeah, it looks like the other one does. Do you wanna do our back one so we don't have to worry about it?
Sure. It shouldn't. We never had a cat with ingrown back nails.
This thing hits it, it's full.
Don't have to do any.
Yes, I hear through. That's the end of the canal.
And so it feels different.
No, it feels the same, but this is truly the end of the canal.
Yeah.
That's not.
Yeah.
It's not even close, you know, but it feels like it. It's like whatever structure it is.
Yeah, you gotta change that setting.
I
Maybe
just
hit
got
that
the
filter.
one, the first one, yeah. But maybe a different one will be.
So weird how it changes. That's
Oh,
like
there
that.
it is right there.
Yeah.
It doesn't look like there's anything in there.
I mean, could it just be binding up on the wall and like?
Looks like it should go right past. Something a little more stout. Last thing I'm gonna do is break a file in there.
Oh, okay.
Taking like really deep breaths.
tests are good.
I feel like she pulled it.
Heart rate change rate.
Yep.
Tried in the 80s. It started off in the 90s and dropped. And you reversed her, so I expect it
Yeah.
to go up a little bit.
She doesn't have any bone crack.
My girl was so jealous. She's like, oh, you're good. I said, I'll share.
Editing's always a thing.
Yeah, I mean, we can have bananas. It feels fatty.
Yeah. She has others and others there too, but I think they're all these.
Yeah, there's one right here.
Did you see that she had a little
One right here.
looking thing in her rectum?
A what?
Like a little
Yeah, this is one of those. Very. Oh no, those might be. Yeah, those might be good.
Who's going to her chest?
I think they're very. Yeah, she's very lumpy.
This machine's done?
Yeah.
Okay. I'm just gonna, did it print out already?
Oh, I don't know.
Okay.
It probably waits for the chemistry to be finished. To print
It
everything
won't,
together.
but, I just turned this on, I just didn't know if they got.
Can't believe 400 pounds.
Got these bones.
There you go. I put her on the slight diet when she started walking a little flat footed.
She might need to lose a little more.
I could drop it again.
Do you want me to?
I don't like that.
You could feel them.
Well, her upper people do work.
I was gonna say, and
I've
they-
never heard of it.
And they've been doing really good at like backing off and not making her do a lot. And
7 pieces,
not,
7
yeah,
pieces.
exactly. So
She drank a ton of water before we sedated her.
I guess it'll be sickle
CBC
bonding
doesn't look bad.
instead.
Can you draw me up a 60cc syringe of that? I think.
I could just take
Thank you guys
Yeah.
very, very much, everybody who's sharing this, everybody who's donating. This is definitely not going to be a cheap vet visit, but it'll be worth it.
Still no luck.
I'm starting to go faster.
Oh, really?
Yeah. Like,
Could it be
Check
just
out the paw
narrowing?
prints that Jamie's
That-
making.
No, because you had that thin one.
It looks like a canal is. This is a pretty good sized canal for her age. I'm thinking it
See
might be
what our
smaller.
magical colors are.
We're still on
Aw.
St. Patty.
That was to say, Merry St. Patty's Day. Oh, baby. I was wondering if, I don't even know if one of her front paws would have fit on one of these canvases.
I would have to squish it.
Yeah. I remember you had to do that with Seth's. Shut down the lights and get all pictures that I want.
You know what I'm saying? Here's what-
We can turn
There's
this
some
on.
stuff coming
Oh,
out.
it's
See,
no,
like that?
it's fine. I meant like I want pictures like with my hand touching my
Oh.
girl, things like that. I'll have to get my hug in before we wig her up. All those things.
This is just straight up EDTA, so if it's something that's.
I promised other
mineralized,
keepers that like they'd get like a "We love you, pet," but can't be here.
This doesn't have the same strength as like any other file.
So have you guys heard
Yeah, I only get 50
and you've ever
millimeters
seen on the
of this.
lives she has like some like
So when I
lumps
first was
kind of
hitting it, I
throughout
was at like 30.
and
Now I'm
they're
probably
like
at
fatty
40,
masses. They just feel
45.
squishy. Nothing we're super concerned with. You know, people have asked about them on lives before.
Yeah, you get a little more depth there.
See that?
Yeah.
I'd like to get all the way, before we even try to make our mesial access here, you know, I'd like to get down further with these hand files.
Just to open it bigger so it's easier to find.
Yeah.
Yeah.
Mhm.
Is this the bag we used yesterday?
Did you use the one that like?
It was at 4.
Yeah.
Then it was at 4.
Oh yeah, because I put the meat on this.
about 250 mils of fluids.
Nice and slow. That's all she needs. Sorry, like her right.
250, that's like a 6 cc for a whole cat.
Figure what would you put a 40-pound dog on? It'd be like 80 mLs an hour, so it'd be like
Yeah, like
800
90.
mLs an hour for this
Yeah,
one.
no, she would be at 999
Yeah.
with the Heska pump.
Are we doing sub K2?
We can kind of. I'll wait and see what the
Okay.
the chem says. But yeah, we'll
She
probably.
dehydrated?
No, she wouldn't.
She just drinks a lot.
She had kidney disease, I think, right? Or did
Yeah,
we?
yeah,
she
no,
got
She's
away?
not, yeah. This is our only comparison.
She's not very dehydrated, so. I'm
She-
hoping.
That's because she was chugging water instead of going in the transport cage for us. She kept like going in every lockout and drinking water for 10 minutes. And
Nervous
we're all
drinking.
like, come on, get over here.
Yeah, her bladder's
Nervous
huge.
drinking.
It just kind of like she starts.
Aw.
So when we go to put her in the transport, she's gonna pee on everybody.
Yeah.
I can tell you that right now. That's exactly what's
So
going
we
on.
gotta choose wisely who we put in the bathroom.
This cricket peed all over me twice.
And she's super even aesthetically.
No, she's doing great for an oval.
I hate to say it, a lot of the tigers, they really do. I feel like if you don't do too much,
No, I haven't had to do anything or change anything.
It's a carnivore diet.
what?
It must be the carnivore diet.
Yeah, yeah.
All our domestic cats eating the kibble.
I mean, they're in the wild, they would just eat carnivore.
Mm-hmm.
I don't remember who told me this. I don't know if there's any truth to it, but do you think you see more resorptive lesions?
Up there
with-
when it just
Oh yeah, I saw that.
starting to go past it.
Do you think you see more resorptive lesions
Oh,
with
yeah.
cats that eat soft food too, or do you think
It doesn't matter.
it
They don't
doesn't
chew.
matter?
They don't chew dry kibble.
So if they chewed, you think that they would probably have
I'm gonna
less
get you guys on the
resorptive
tripod
they were
and then
eating
plug
mice.
my phone in.
That
Can
time
anybody
would have
tell me
year.
how long
Yeah.
I've been live?
Tooth absorption.
Yeah.
I'm just worried about
Obesity,
phone
thyroid,
battery.
Yeah.
all that stuff.
Yeah.
I mean, how have we not like figured that out? You know what I mean?
Yeah.
I don't want to sound radical, but I do tell clients, I'm like, well, if you want to know the truth, catch your feet and mice. They're like,
How many cats you
what?
find out in a cornfield chewing on a piece of corn?
Right.
And all that dental disease that they get.
Did you say she was limping a lot of the front paws?
It's
rear paws,
more
right?
like her
Oh,
back
she
leg.
like flex
Yeah.
collapses.
Yeah.
Yeah.
Just like LS disease.
So she's almost like walking in this curve a bit.
It doesn't really stop her. She chases my car in the morning when I do the room. So we go really slow to not encourage them. And the other day, the keepers were coming to feed her, and there's a den right by where she eats,
Yeah, okay.
and she thought she would be really sneaky and try
Well,
to
you
jump
can't
up
do
there.
this fast,
So like,
you know?
I listened to this
I did
podcast
too.
that's
She
called
got the
about
front
human
ones and one
nutrition.
foot up, and
And
was like, I don't think I could do this.
there's like a bunch
And
of
she's
Okay,
just
live
like,
for
"Oh, okay."
about an hour. Okay,
They
yeah.
chewed on
Alright,
harder
bear
parts.
with me. I'm gonna put you guys on this tripod.
And it's very easy
If we chewed on what?
harder
So you can
things. Like
still
we
see
ate
Oh,
in
like
like
here,
we
and
used
then
our
I'm
jaw,
gonna get
yeah.
my
if we used our jaw, and so like you wouldn't have all those crooked teeth. Like
Yeah.
your teeth would be much straighter if you were just
Well, that's-
using your.
They think that's why we have the narrow jaws.
Mhm.
You know, like back in the old day, our jaws were
Just
wider.
do it for in person.
We had these, you know, just bigger muscles and we chewed more. Now it's like my son eats everything out of a packet.
I know exactly, yeah. So like, but that's what they say is if they've like actually done it where you give children hard things and then they don't need
Okay.
orthodontics later.
So we have interns that have been watching the procedure from the upstairs viewing area, which is right above the table.
But I guess you probably
And they're
run the
going to
risk
come
of them,
down
like,
and each
have
get to
another
have an
issue.
experience of
Yeah.
seeing Kali up close.
Right.
fun time.
If you have questions, both doctors are very happy.
Yeah, I always have this debate with a lot of the fossil hunters that, about like cat teeth, because I always call them worn down, and I'm like, they're not worn down, they're diseased, they cracked the tooth. And
My
then,
other question is
Yeah.
going
you know,
to be,
like
how
they
is your view
cats
from the
tend-
explore camera?
It's
Do you
rare to
guys-
see like
are you
true
guys able
worn
to see
teeth.
from up here?
Yeah. Oh, for sure.
And they can keep rotating through.
The dire wolves, you see them, you know, like you'll see the wolves with those like worn down teeth, but cats, I feel like.
I knew it was
I feel
going to
like they
happen.
fracture and then they just have a blunt tooth that they kind of wear down just because it's blunted, but
Oh, yeah.
you know, it's not like,
If you can just go ahead and
Exactly.
send your next person down. There you go. And then you can go down there.
Charge, so now I'm like,
two, he's doing
Yeah.
the 203.
203, yeah.
203.
I don't- and I'm trying to keep it so that we're gonna use the same files. So in other words, I'm not gonna, I could just keep rolling on this 203, and this thing can be quick. But I wanna keep it so that I'm doing the same steps.
Save time.
Yeah, so I'm not gonna, like, I'll be working on this canine a lot more than I will that. You know, it's taking a lot longer. But at least I'm getting down now through all that. Start to catch right there. I'm getting flush down there too. This one takes this flush pretty well. Got bleach going this one, but more EDTA in that one because I can't get down. The EDTA is more helpful for that decalcifying effect. But I'm fine if bleach just sits in this one, you know, for a long time.
I'm just going to tell the internet that it's the doctor and why they can't see it. Just kidding. If my camera breaks, it's Justin's fault.
He's reached down. We're not putting it there. The one who's got a follow.
Wait, and
And then small incisor on top, and then once we get through that, he's gonna pull another incisor that's like broken.
Yeah, entitled been between 25 and 35.
Or
something
extract.
like
Extract. Pulling teeth.
Pulling teeth.
I'll do layman's terms.
that. Her favorite tool.
Oh, the diggy tool.
She calls it the diggy tool.
Yeah. Oh,
I
excavator?
think
Is that what we call it?
the elevator.
Elevator.
What'd you call it? An escalator?
Escalator.
Excavator?
Escalator.
Oh,
Okay.
that's a like a
That's awesome.
bobcat.
No excavator.
Listen here.
Did you bring the bleach in?
Yes,
You have it?
it's sitting on the refrigerator. Do you need me to get you some somewhere?
Can you pour some in that stainless bowl?
Yeah, absolutely.
Please?
Diggy tools on the eyes, right?
Yeah.
Yeah, we can just go back to saying that for sure.
Right now we're at that point. It's maybe, now I'm over my measurement. So I'm probably 55 to 60.
It's not. No. It's probably just exaggerated.
These are the tiger files. Notice how long they are. So they're still, what's that stuff?
You're
Doesn't that look like that plastic?
Does.
Oh my lord.
Now 5 centimeters down. 5.5 centimeters. She definitely likes the left side.
Yeah.
She like must do that. Because these have more of the abrasion than these. You know, they have it, it's just like, it's worse on the left.
Wow.
And these, I don't know how they fracture those. I mean, it could be anything, little rocks or. Cats probably try to keep rocks out of there.
Yeah, we don't.
Yeah, there's not a whole lot of gravel or
Yeah.
rock in most of them.
Is it a 304 or 404?
It is the
This is 304.
304 and the 203.
Yep.
And then the 102 will probably be extracted.
We're gonna pull it off the diggy tool.
The excavator.
So are these hers ready to go? Those are for send up. Yeah, like about 3 minutes left and we're going.
Yay. Where'd that pack of gauze go? That was.
Right here.
Oh, there it is. Perfect. Thank you.
I was gonna do this next shortly. That's what we cover nails with. Clove trimmers. Getting things for TikTok.
I was gonna say, are you?
I'm trying to get a picture for her as she walked out of the frame.
Oh, you're TikToking.
I was gonna ask if you've been doing more on TikTok or Instagram.
I've been doing some on TikTok and Instagram.
Yeah.
I just don't have the, I don't have the time to, like, I hate not answering the questions and providing a detailed explanation, and that's hard.
Yeah.
Oh, see,
You
I
know.
just post pictures and I don't say nothing about
I
it.
know.
I was
that's
gonna
what
say,
should
I do the
Months
same thing.
later, I'll go like the comments.
Yeah, I mean that's my
The
problem
worst.
is that like I hate just like posting a picture and then people are like, "What happened to her?" You know,
Right,
especially
yeah.
on TikTok, it's like you're killing it.
It's
It's
overwhelming.
like
yeah.
Gingerich would be like, it's like he's attacking the tooth. You know, it's like I feel like I have to explain it so much.
Yeah.
I heard it was like,
I
killing it.
gotcha.
I'm like, yeah.
Okay.
No, you're fine.
Totally killing it.
Do you sell any of the stuff? You sell anything that you find in your
Not
videos?
really, no.
You don't?
Oh no, I sell some teeth on like necklaces and stuff.
This,
Some, like, shark teeth.
This friend of mine, this guy,
Yeah.
bought
Not
a bunch
tiger
of
teeth.
megalodon teeth from somebody.
You what?
He bought a bunch of megalodon teeth
Yeah.
from somebody.
Shark's teeth.
And we were out on Sanibel last weekend. You know how it's a big shelling? Like
Yeah.
Sanibel is like the shelling capital.
Yeah.
And so we're out there and his grandkids are out there playing and stuff, and there's all these shellers around. Well, he buries these megalodon teeth in the sand. He's like, "Hey, dig right here." And these kids like pull these megalodon teeth.
That's pretty cool.
Oh yeah, and the people that are shelling are like, "Oh my, where did you find that?"
That's funny. Yeah, you know what's funny is I probably know the person
That
who
sold
sold them
probably.
to him. I probably
Yeah.
know them.
Because he asked me if you sold your stuff.
Yeah,
said,
I mean I sell some. I don't find as much. Like I have friends that do it commercially.
You know,
Yeah, they make more than us.
yeah.
Did you want to try?
They dive a lot.
Yeah, they dive a lot. And they dive in like 110-foot water.
Oh jeez.
Did you want to try anything else?
What?
Did you want to try the rest of the mouth?
No, it's okay right now.
They're
You just rate wearing on all
people like
4
stuff.
of the canines.
There's like a black toolbox with a blue handle.
Okay.
Nutrition. Is that something? Is it wearing? Yeah, I thought it was wearing on that one.
This much of safety inches, and they do it with Suez, and then Sue gets.
Yeah, I'll just clarify that for everybody in the comments. Dr. Justin dives, and it's shark's teeth,
Yeah, shark
and
teeth. Yeah, shark teeth.
not exotic animal parts.
No. Fossils.
Just
casual.
Fossils.
It's just casual vet talk here.
I love that. Is that what you do the videos of, or you do videos of vet work?
My stabilizer
This is
going
vet
down
work. So I do
there.
some vet work, but
Yeah,
I like the fossil stuff because I could like just post it and not explain it as much.
yeah.
But you know, like if
Oh,
it's
that's
a,
the wrong one.
if it's a,
She got Catheter.
Blood work?
creatinine's 4.6, GUN's 45, estimates 15, to 1 point over normal. Glucose 189.
Is that like a
Amylase is high. No, that's like fat.
Oh, she's not chunky. You know what he's talking about.
So
like
I would say
it.
mild kidney disease. The BUN is rather low for how high the creatinine is, which is good. I feel like.
You want her on Azadil?
I mean, she'll take it.
Oh, for
She'll totally take
Then,
it.
you can
Yeah.
put her on
I'll
Azadil.
just drop her diet down.
Yeah.
A little bit.
It's really
more.
weird that supplement Azadil, which I've
Sorry.
heard doesn't work. It's like it just like lowers their. I'll tell you what. We'll put cats on it, and then like we'll recheck them a year or two later, and their creatinines will be way down.
Oh, really?
Yeah, like
So it
pretty
does
significant.
work.
It does something.
And then
At least in the big cats, because
Yeah.
the creatinines that are elevated in these guys, like I don't know what's. It's not the same as like if I saw this in a domestic cat, I'd be like, he's dying.
yeah.
You know. And the cats just the big cats just live there.
We'll get some Azadil, baby.
Yeah.
Is this thing ready to go? This demo unit? I'm gonna use it here in a second.
Yeah.
We'll take a look. Let me slide
Get it hooked up, ready to go, and I'm gonna try to.
Alright guys, I'm gonna have to
Make
fix
an
the
access
camera.
Should be plugged in, and then just make sure that
See if we
breaker isn't
lost the
flipped.
stabilizer or not.
That breaker.
Learning new things.
Yeah.
Hopefully not.
Why is it waiting to get an extract? Or is it like fractured?
Yeah, it's fractured.
There's the front of the neck.
Hopefully that gives some open pulse.
The other incisors are no people.
Do you want me to write pulp exposure and surgical root canal or just surgical root canal?
I would say pulp exposure and surgical root canal for both of those.
These are standard root canals, not surgical.
Sorry, yeah, sorry.
And then.
Is there a difference?
Yeah, surgical is when we do the apical.
It says you call that a surgical root canal.
Mhm.
Okay.
Yeah.
And that's what when they're like infected at the apex. You know?
Oh, if we couldn't get to the apex.
Oh, that too.
Yeah.
Do you do many of those?
No,
No.
not many at all.
We had our first dog, and I think since I've worked there that we did a dental on last week that they didn't want me to extract the 208 because they wanted a root canal.
Oh, really?
Yeah. We offered it and they said sure, and so they booked like an emergency appointment with teeth, but I just did a dental and I
Yeah.
extracted some teeth that were like resorbing and stuff and got x-rays.
Did you fill up the water?
We didn't bring it up. She brought it up. She's
I
like,
did,
"I'll remove
yeah.
it."
Yeah.
Okay.
And is the cleaning
I can do it here.
Yeah.
It should be because
good
we've
too,
never
the
filled
root
this
canal.
since I've ever done this.
Mhm.
And so that's.
Oh, for sure.
Seems to be a lot enough.
It was a healthy
Do a
one.
lot of 08s,
Yeah,
yeah.
it was a healthy one too, so.
And it wasn't like cracked in half.
No, it was like
This one's
barely
almost
pulp
out.
exposed and then
Yeah.
just no disease at all at this point at least.
You want her to get the other bag?
Yeah,
That won't kick on until you start
you
using
could probably
it.
just
correct,
pull that
Kristen?
line and put it in the other bag.
Yeah.
Do you know about that business?
What?
The dental machine?
What's happening?
So far it hasn't kicked on. Does it need to use it first? Because I.
Yeah,
Might have been pressured.
it might have been pressurized.
Okay.
Yeah, it's pressurized. You're good.
Okay, cool. 'Cause that's the right
Here comes all the fun dental
Really
noises for
screw
you
me up.
guys. Thanks to everybody who is donating and sharing with us, helping out in the comments.
Everybody's favorite noise.
That's what I just said. It's like, here come the dental noises.
She's got around 600 right now.
This is probably like the trickiest part. Making sure that you're in the right line.
And then finding it. Yeah.
Because you can kind of like watch the course and have an idea.
But I guess it could bend
Uh-huh.
under.
Yeah, if you
Looks
watch
like
like
you're
the
right.
course of where it is. Of course, I don't know what that It doesn't take much to be off.
Easier in a bigger animal?
Hmm?
Easier in a bigger animal or
Heck
harder?
no, a lot harder.
Yeah, that's what I was about to say.
This is the length. It's so much greater. And then there's so many different angles to look at. But it's slow and start feeling and see if we're getting close.
An hour and a half. They're all still.
Whatever.
They're still looking.
Oh, like,
He ran away?
Yeah.
Nearly.
Who did?
It's not good off.
No.
We had a injured wild bobcat.
Oh, yeah. Came up in here?
No, we sent people like that were supposed to help here to go get it an hour and a half away.
He ran away.
As soon as they got there, it ran away.
Did they see it at all?
They said it ran fast. I asked if it was like ataxic.
Sounds like you've been seeing a lot of bobcats.
Yeah, we've been getting a lot, man.
It's been a wild
We have busy.
season.
That's an understatement.
And weird cases, I mean, just
Mm-hmm.
making me feel uncomfortable.
He said he was
We-
very mobile, but I mean, it's kind of hard to like, I mean, touch on a person.
Mm-hmm.
to
We
see
had,
what kind of mobile.
we had some kittens that came in that ended up with Khaleesi.
With Khaleesi?
Khaleesi, yeah.
Oh, really?
Yeah, they died.
Yeah.
3 of them, one got
One
taken.
got it and recovered.
Yeah,
That's
one
good.
recovered.
That's
yeah.
the one you took teeth out of
Yeah,
yesterday.
oh yeah, that is. That's the one I pulled the teeth out of
The
yesterday.
cause of bad teeth.
Oh, that's a good question. Or all the medications that you had to pump into her to save her.
I don't think
oh, you
so.
can get
I don't think we
roller
gave any
coaster on, you
weird
can sit on the
meds
major
to
ones if you
her.
want
She
to.
was on
Just
antibiotics.
like
What
sit around or
antibiotics?
duck under
Yeah,
the
just watch
machine.
cords and stuff.
Was it Doxy?
Vera, she was on some nose drips.
I had him take him to
Did she
UF.
get
I was
injections
like,
or just?
I'm
she
telling you,
got
I'm not
drugs?
gonna be able to help.
She got
So
everything.
they're gonna need specialists. And then we had another neuro bobcat that would like, they caught it and it would circle until it passed out for like an hour. And then it would get up and circle.
Oh, wow.
And she took it to Levine. He scanned it, did a CSF tap, and nothing really obvious. Had like a bunch of lesions through the CNS, and just Doxy and Fred got better.
Yeah, got in. Oh,
Yeah, went from like blind to.
She was on interferon
celebration.
Interferon,
and Clavamox, Serenia, Baytril,
Batral.
then gabapentin.
They get a lot of neuro stuff, don't they?
Yeah, we've been dealing with FLM. We have a cat that we think right now has FLM, and working with FWC and trying to figure that one out. That weird cougar disease. Have you seen that?
Yeah, like their biologists.
Yeah. So they
Yeah, they had some cougars down in Naples.
Yeah. So that we've had a couple bobcats with it. I think we've had the only bobcats with it. Has there been
They've
anywhere else?
had others that only survived like I think days.
Yeah.
That they've gotten alive.
So we have
I think there's been 18 bobcats.
Oh,
18.
wow.
Yeah.
It's either 18 or 11.
It's pretty bad neuro disease. The one now is like kind of
Those sound
it's managing well on
And
Fred.
and Winter's
Doxy.
still the only
mean,
live
and
one
we're
that they
just
got
gonna see it.
samples from too, right? Yeah. That's
See
Interesting.
how it
So you're
does. Like
making
it's
us
kind of
take
got like a
one
neurological.
bobcat at a
tick.
time.
It's doing well. It's like
over
not
there.
I was just
suffering or
gonna-
anything like that.
keep
but
adjusting her.
It's a little off. And it's like supposedly just like a progressive disease. So.
Mm-hmm.
And there's no way to really diagnose it, so we don't really know that cat has it.
Yeah.
They sent out a doctor, got some CSF samples, and they brought it to the lab. I guess that was the first time they ever got CSF samples from a live
I'm so sorry.
cat
Yeah.
that has FL, or possibly has FL.
Different angles, make it more fun.
Oh, and then we have the miniature one.
It's a really good view.
Yeah.
Yeah, we got one
Pocket
that's like,
size.
it's like,
And I'm saving my
I
wrist.
swear it's like
Yeah.
a door.
And like my
A
shoulder.
good close up.
It's tiny.
Like imagine someone just
How big
like
do you think?
deciding to view in the
She's 6
middle.
pounds now. She should be probably 10,
Yeah.
12.
Jeez.
She's like 8 months. She's
Yeah.
6 pounds.
She's smaller than my house cat.
Yeah.
Oh, wow.
Yeah.
And I have a
She
tiny
came
house
in
cat.
all like
You too. Tigre's feet are like
Messed
dime
up.
size. They're so cute.
to an emergency
Yeah,
clinic
I have a
actually
little
to watch
rider
she
cat,
works out.
definitely still smaller than her.
We had any other crazy ones?
The one that was shot.
Oh yeah, the one that got
Hit
shot.
Val,
And
yeah.
when we caught it, it had like a chronic non-union of its radius ulna, like, and it was like bent backwards and twisted around. I amputated its leg because it was just so bad. Its carpus was broken, its radius ulna was broken. It was like blind in one eye.
You guys still have it?
Yeah. I
This
mean,
got
it lived with all
amputated
those
at
wounds for like
Yeah,
probably
2
6 months, a year,
Mm-hmm.
and it was surviving. And then these people caught it taking some of their chickens, and they shot it.
Oh, jeez.
And it was like hunched over like this, and they shot it, and it went through the scapulas and the scruff.
And survived it.
It was fine. Like it was like barely a flesh
Still
wound.
very
Yeah.
ferocious.
Like totally,
Yeah.
totally fine from the shotgun, or yeah, I think it was probably an AR.
Crazy.
But yeah, he
Survived
amputated
it.
that leg because it was just
The tip
so,
of the back.
it was so, just chronic.
Mm-hmm.
There wasn't any fixing it. Like the carpus was kind of really messed up. And when it took off the scapula, there was a heartworm just sitting behind it, just like.
That's everyone's
Like,
reaction.
heartworm.
In the muscle? Or?
No, just like out behind the scapula, like, you know, when you pull the scapula up to like block all the nerves before
Yeah.
you, and then, yeah, it was just sitting back there.
Wow.
When it happened, I literally thought he found like floss. Like it just like coming
You
out.
saw
and
it?
Yeah, we were in the room and I was like,
Try your own 15 minutes.
I laughed, I said that heartworm was so close to getting shot, because it was like right next to the bullet hole.
Yeah. Oh, that's crazy, man.
disturbing.
This is crazy stuff.
It's been a weird year, and it was weird because the previous year we were scared that there weren't any wild bobcats, because like, we got like no calls.
Yeah, 2020 was like no calls. 2021 started getting real
Because
weird.
no one was on the road.
Yeah. 20,
Yeah, maybe that's what it was, no one was
it had to
hitting them.
have been. And then 2022 is like, I'll show you 2021. Like,
Was there any other weird ones? There was like, it was intense.
Mm-hmm.
We had Malaya, who's going to be released next month.
oh yeah,
The
circles.
Circle,
Non-spike
circling.
Oh, that was just the one that Levine scanned.
Yeah.
Mhm.
Oh, and then the one that it was at another rescue. It was probably getting the wrong formula, and it was like it had multiple pathologic fractures, and it was
Its bones were bendy.
yeah, they were
Oh,
very.
Autumn, yeah.
It was very. It was in a bad spot, but now it's fine.
Our little fainting goat.
Yeah. Do you remember the videos
Yeah, she would
of her
just fall
fainting?
over.
She
Yeah.
would just fall over like she's paralyzed, and then eventually get back up. So weird.
Do they feel like the bobcat populations are really high right now?
It's all
That's-
estimated.
They don't know, because we were talking, I mean, yesterday we collared those two, and that's really what they want to find out. They're also taking samples for genetic testing to see how inbred they are, because they're concerned about, are they like just breeding with each other?
Like
Yeah.
That's why I always tell them, I'm
We've
like, I
had,
don't really talk during
one
these
that was, like,
lives, so you
only
can hear all of
One
what
that
everybody
has
else
here
is
that's
saying.
really inbred.
Don't need
It had
to,
like holes in its abdominal wall and like an
plus
eye
there's
that
like
never fully
15
formed.
more
They're
readers
all
on there,
up,
so they're handling it.
And it did fine.
Take
but-
your business.
Mm-hmm.
Stephen, look at your
Um,
comments.
We tell, it's public what happened to the one collared cat, right?
Yeah.
We posted about it.
Yeah. So some guy shot one of the collared cats that we
Oh,
released.
did they really?
Yeah, killed it.
So they find out because it stops moving?
Yeah. and it was in the guy's house.
Yeah.
Like you took it
Did
home
they
with the
take
collar on?
that bobcat?
And they had to like,
Did we swap out?
they said they had to
bobcats this
I
year?
gave-
bargain with him to get it back.
The other one?
Oh, he thought
Okay.
He wanted to
something.
put it
So
on
she
his
asked me to-
taxidermy.
Is
Oh,
it
no.
legal to shoot bobcats?
I should do
It is.
December through March 31st.
Oh, it's a season.
Yeah.
That's weird.
But yeah, he wanted the collar for his
Yeah.
taxidermy mount. So they
There's
had
no
to
rules
like bargain
against
with the
it.
guy and they gave him an old
There's
non-functioning collar so they kept that.
Because it just doesn't make sense.
I was like,
a
isn't
lot
that
of
like
money goes
FWC
into
property?
collar
Couldn't you
and
like
gas, and
just
when you
do
have
away with that?
a research
Yes.
cost of 2 animals in it and one.
It's enforced.
I mean, what's he gonna do with a collar, you know?
Just put it on his taxidermy mount.
That's so stupid.
From what I understand, it was like a bunch of hillbilly rednecks.
Yes.
Like,
Yeah.
yes. I just want to keep the collar on.
We're getting close. I did get through all buying that. You can see I've got it now into the canal through the mesial access.
You still got some distance to go down.
Yeah, I mean, if you look at where I'm at.
Oh, maybe. It's getting closer.
Making headway. So it's not a fast process.
Her last two.
Surprised they haven't figured that out. I guess there's just no good way. It's
I
more
found out
like
last
art.
night.
If they made
artwork.
if they made these giant rotary files
She was
for
getting
this,
Yeah.
all of them. She
you
didn't
could
care.
blast through this.
Yeah. So you've gotten pretty fast with
And then,
like a
she's-
dog
Oh,
or
if this was a cat,
so
I
she
mean, we'd
kept
already
turning
be
off the
packing
sound
up.
thing, like,
Really?
she's never
Oh,
done
yeah.
Yeah,
Yeah,
a dog,
so
I
that
mean,
is
it's,
a key
it's like
behavior,
3 times
you
as
know?
long.
And
I can do a
she
dog
thought she was
consistently in
so
45
funny.
minutes
I
or
sprayed
less.
her balls with
Yeah.
I mean, I'm an hour in right now.
Dentist.
And she picked it up and then walked away and smiled.
At one point, she flung it into the air. Did you see that?
Uh-uh.
Oh, my Lord.
I wish you could do one of these in an
But
hour.
it was on the side.
Sizers,
She
you
was
know,
like
that's simple. It's
really
not a big
feisty
deal.
after I fed her, and I was like, "How did she always play?" And I just took my axe and I was like, and she was not sure about that.
It's
And
like
then
even
after I
just
just
ripping
held
that
out
little
the way she
file
was like-
forever, you know, because the
And
stuff
then
gets
she was
wet.
like, "Ooh." But yesterday,
It's
the
funny, like,
cleaning
you know, you
told
could
me-
tell it's
Oh,
art because
boy.
I've had a lot of root canals. I think I told
Very
you this
helpful
before.
cleaner.
I had this one guy around the corner,
Mhm.
and as soon as I saw his first root canal, I was like,
Last night.
that is beautiful.
Yeah.
Like it was just,
Mhm.
and he did a couple. I think he did like 2. And I mean, when I look at my X-rays now, you could tell which ones he did. Like it's
Mhm.
just, they're just so smooth and even, and they
Mhm.
go from bigger to like to really get all the way down to the apex. Just
Yeah, I just bent that one. This one just went all the way down.
You tell me about the teeth you took out yesterday, how bad they were?
yeah, they were pretty bad. They were
On the bobcat, right?
yeah. They, I mean, it was so thin walled. It was
Oh, yeah.
unbelievable.
Thing would just break off. We could have done multiple procedures and then you go out in the wild and snap it off, and it's not worth that.
Yeah.
I mean, I don't know what it means to a wild cat to not have a canine. I know that there's a lot of police dogs that don't have canines. They're apprehension dogs. You know, they still work and do their thing. You know, I'm sure they lose the ability to like hold on to prey. Like when they first grab something and it's moving and they're trying to hold on to it, it might slip out of their grip a little easier. It's not like they're chewing it up with a canine. You know, that's all premolars and molars.
Yeah. So maybe they're just picking. They're probably picking and choosing what
Yeah.
animals they eat.
I feel like it's less important for like a bobcat compared to a panther, because the bobcats are eating all small prey.
Yeah.
Panthers gotta hold on to a deer.
Yeah, exactly. I mean, I think they do just fine. I had a client send me photos after extracting all their cat's teeth. He would still go out on the lanai and catch lizards,
Yeah.
toothless, you know, and he still had them in his mouth and everything.
Yeah. I don't doubt it.
It doesn't slow them down. I mean,
No.
they're like, I'll still catch something. Just because I don't have teeth.
Well, it's like that one jaguar we saw that was like floating down the river in the Canal that had like, it had at least one like horrible fractured canine. Like to
The one on the cow?
yeah,
Yeah.
and he kept like floating down like the river, and there's a dead cow in the water, and he'd float down, and then he'd grab onto it, and just like rip off pieces,
Yeah.
and then he'd get so tired trying to hold on that he'd like float back, and then he'd just do it over and over again. Like he did it like 6 times. But you could just see one of his canines was just
Could you?
yeah. Those jaguars get big there in the Pantanal.
Yeah.
Yeah, every time I read in a book like a 200-pound jaguar, I was like, BS.
I think,
But
yeah.
they're big.
but I think Alan Rabinowitz said the biggest one he had was like 290
Yeah.
something,
Yeah.
which is just
That's a tiger
insane.
size.
Insane. Imagine a jaguar that's like
two of our cougar cubs.
like the
at one
size
point,
of
like,
the majority of
like-
tigers that we work on,
Mm-hmm.
like Zabu, but a jaguar.
Yeah.
Oh my god.
Thank you.
Yeah.
Just
Okay.
get all the way down.
Do you feel it?
Oh, it's going. It's getting down there. It's just even between my smallest pile and the next biggest one, it just takes so much
I wonder if we
time.
could just order like skinned ones, like special order
So
somewhere.
he's got
I
to
know
take
they
each
sell
file
right
and
at
slowly widen the canal.
Land-C.
What do you use to, oh, okay.
We have
So it gets
endodontic
like
materials,
that.
same ones they use in people.
I think
Oh,
of-
okay.
So the main ingredient in the filling material is called gutta percha, and it's a natural rubber-like substance, comes from a tree, like in Central South America or something. So gutta percha, they just found, whatever, 100 years ago when they first discovered that this was a good endodontic material, that it has all these properties that make it suitable for a root canal. So first we gotta get all the bacteria out of it, which is the biggest job.
This one.
And once the bacteria are out, then we're just filling it and sealing it so bacteria can't get back in.
So
So
that's why you flush it every single time, like.
yeah. Yep, we file and flush. So right there it feels pretty,
Using dilute bleach. Yeah.
it's well beyond any file
So
length.
we could put them on antibiotics or anything like that?
No, non-steroidals for pain.
Said no reason for
Is he
it.
getting,
Yeah.
Wolfrey at all?
He does it
But the problem is down at the apex of the tooth. So in a root canal, if you never reach the apex, which is the big trouble with a tiger or any big cat, if you don't ever reach the apex, then you feel like you didn't really do it justice. You know, it's like you need to get down there and get the bacteria out of the end of the root. And
That's where I feel like
It
the
should
infection
happen
always
next week,
is.
so
Because
we
they're
should-
seeping, the bacteria are seeping out of the end of the root into the surrounding bone. And that's where you get a dental abscess, around the tip of the root. So say we couldn't reach the end of the root, you can go through the skin and do a surgical
Yep.
root canal. Cut the end of the root off.
Yep.
It's another known technique for, sometimes that's the only choice you have in big cats. If you have obstructions in the canal, you can't get down. Sometimes that's the method you have to do. I have to give you a couple rounds here.
So is this for every cat?
It's
Or
like-
is it for like what cats?
I can get this is my smallest file. I can get it down. There's a bit of pulp on it. That's good, seeing some soft tissue in it finally. But right there,
Depending on how long.
stops.
I think that's the
No,
tip.
but I would be better
I
than
think
than
so.
that,
See
'cause
that
that's,
pulp?
that's
Oh,
gonna
yeah.
have like processed
But it's
sugars.
bent my
and
file,
that's
see
what I
how
was like,
bent my
Yeah.
file is? That's gonna be breaking off,
This one, because I'm like, it's clear.
which is not good. But yeah, look at that, that's soft tissue. That's old necrotic pulp down there.
Yeah, I'm sure your
Mine doesn't
hands
have,
hurt.
like, sugar
Big
or
dog dentals
other
kill my
stuff.
hands.
Heck
I could
yeah.
I could do like cats all day long, but
Cause
those
I
big
even,
dogs,
like,
oh
Can
my
you
god.
cut the very tip of that right where it's bent?
Cut it?
Take it with scissors and just cut it off, yeah.
Yeah, it's that.
It's better than it breaking off
Yeah.
in there.
You're gonna ask him what he thinks
Yeah,
about
I
that one.
I had 3
Yeah.
canines in the dog today, and by the third one, my hand is just
Oh, yeah.
Banana leaves.
Well, I tried to tell people that I think it's the most physical. Of course, surgeons, they'll argue with me. I'm like, I'm telling you, what I do is more physical.
I think that it is probably. There's occasionally that I do a fracture repair that I cramp,
Yeah.
but I would say 80% of big dogs, if I'm extracting a bunch of big teeth in them, I cramp. I cramp bad.
Oh yeah, I mean, it's just so much grip strength and
They see it.
yeah. Because you're having to hold it for so long too,
Yeah.
Was it Hutch's?
They,
Like, yes.
I've seen them they freeze catnip in it. They've been doing other like random herbs, like a rosemary one they did. They were freezing actual pieces of shrimp in them at one point.
Then
in
I always
time.
wonder, like, are they saying, wow.
It's
But I don't know if they're
catching
using
something
fresh or if
it's
they're using
doing.
what comes in the bottles. But we've been handing random ones out like that on Sundays occasionally just to see if they like it. And what they
Could
do
be
with the
that I'm
catnip
jamming it
ones is
down
rub
a
their
bit.
faces on it. They don't actually
And
lick
just hit the
the.
apex.
That's so cute.
I feel like catch before it gets down, like it's happened before
Where
that.
they like hold it
Yeah,
out
we
and then
put
the stuff
it
hurts
was
and
the herbs.
they did like liver, but you could do
Liver
like,
was-
yeah. They used to do like spices and those too, and that's
Yeah, and sweet potatoes aren't bad for that either.
Let's just see if we're down. See what we got.
Okay.
I don't know if we can get a radiograph that's gonna show us. It's like so much to shoot through.
So your opinion, not the ones printed, but the one in purple. So you shut the other two down.
I mean, if she thinks it's okay, I don't see the problem with it. Like, I'd say more it's on the individual cat basis. So I think
for
it's
the
a,
ones that can't have.
yeah, that's what I'm saying. It's like, I'm okay with that for any cat. So if you think the cats that are,
I don't know how they'll feel about it.
yes. I don't think there's anything wrong with it.
Hutch
The
will
You wanna
try it?
give him.
try and see.
Okay.
Justin, can I
Yeah.
get you?
I can have them make some.
I haven't
and
read
then
it yet, so
we
let's
can
do the
do
click
that
and let
if
go.
you would.
Okay.
I would suggest the potatoes thing. Maybe not sweet potatoes because they're harder.
Okay.
If they like chew off a
Yeah.
chunk.
Okay.
Yeah.
But just regular potatoes
Okay.
and
Let's
they
do
do
that.
that.
Jamie,
And then I
watch
could
out.
bring in some.
Jamie.
I could bring in some leaves.
Okay.
Try.
Yeah.
Then we can make like a
So we
really
got
creative for the.
Jamie, please. Rick, please. Love to still get this red one down.
And it hasn't popped up yet.
Someone else.
Is that it?
Did my part.
Very. They typically
the inside.
are. I hate to, like, I need wood to knock on.
Yep, there you go.
But it's like, they really, they do well.
Yeah, I heard both of them.
Good. Yeah, especially if you don't reverse them, they read bad all over, but they seem stable. Do you get what I'm saying? So it's just like the peripheral
I'll text him.
vasoconstriction that's like making the pulse ox not read well, the blood pressure. You know, you're not able to hit a vein, and then you reverse them, and they're just golden.
Justin, we'll do some filing.
Sure.
So this is it. We made it down. It's right in there.
So we
Compare.
don't have
So
a
it
super
goes
current
with
weight
the
on
other
Duchess,
one.
but Afton recalls when we did weigh her that she was maybe 320-ish. Oops, sorry.
No, you're good.
And today Kali weighed
About your
400.
stomach.
So
Look.
there is zero question
This
that
goes
Kali
down.
is larger than Duchess.
Yeah.
For
That's
now.
not worth
For
it.
now. Yeah. There's some diet in her
Just
future,
trying to
but then there's also supplement
So
treats.
now we'll
So
flush it.
Yeah, we're gonna compensate for that.
that'll be a thing.
You can do a little twist with it if you want. These are H files. Technically, you're not supposed to twist, but
Ruben keeps
They're
asking
such
about
big,
Justice's weight. I'm like, none of
heavy
us can
files
recall
that you
specifically.
No,
We
it
just
had to been like 325 or
Like,
340 or something like that, but it was not. Yes, I would remember something like
Oh man, that's why your hand hurts right
Definitely in
there.
the.
See what I'm saying?
Oh, you can really feel
so
it narrow.
Dr. Justin's
Oh, yeah.
doing some of the
Oh,
filing.
grab it. There you got an instrument.
Justice was 308 in 2019.
Oh, 308 in 2019. Okay, yeah.
Thanks, good job.
Girly.
It's on the cat census.
Because I
It
knew
is.
we were one time
Yeah,
vacation.
you're in. Wow. Really gets tight.
Mm-hmm.
Doing a great job.
Somehow.
Yeah, he's a natural at it. If you want to feel the comparison, take the smaller one and go all the way down. Catch it because that's a little bend in the
Yeah.
We can kind of push through that.
Oh, it is a little bit further.
I might have moved that rubber stuff a little bit. You get an idea of the difference.
That makes it really
It's
easy.
okay, I'm an auntie, so
So you're just,
they're not necessary.
And then what we can do, Justin, is you can go to the next bigger one, because sometimes that's what it takes. You gotta go bigger to open up more coronal. And then go back to a smaller file to get down.
oh,
You know what I'm saying?
yeah.
And here's the next bigger one, take that. And also, before you go in,
Okay.
let's do a little bit
Flush.
of our flush, because this helps to lubricate too. It's not just disinfect.
Are we gonna just?
Look at that. That didn't
That's
hold.
full.
Yeah.
We could
So
probably.
now try.
I guess we could have a can on there. I was gonna just attach her to her cage.
So we can just like.
It got way easier with this one because of the,
See how she likes it.
you think because of the flush?
'Cause we can use
Maybe.
it properly.
Yeah, if it was getting dry.
She's a lockout cat, like, I
You gotta
love
flush.
sitting in my lockout for you, so whenever she's.
This one seems to be
But we've never sitting with
getting
her,
down there
so
rather
we
easy.
should probably-
Does it?
if we
Yeah.
have like a idea for you.
compared to the last one. It was like,
Yeah,
I'm
well,
working on
you
that
gotta
one.
remember though, that's the length.
Move my legs.
You're gonna have to go back to.
In the knees.
Stop it right there. Stay on.
you don't think you're at the effect.
Let's see this one.
He's gonna just keep trying.
Maybe put the other cages on top.
Yeah.
Lengthwise.
Oh, you already got one on?
Like that.
Yeah, you did that.
Yeah. That's not far off of it.
It's not.
So, this is 25 and 30. That's the 25, the red. The 30, the big one is the blue.
The big one?
Yeah.
No.
Yep.
Wow.
As long as it's
They use the
what
blue.
they say is, yeah, you could go with blue for a little bit, and I'll give you even a bigger one than that. We'll go up to the, because that way it's like we're making a funnel. You know what I mean?
Yeah.
And the wider it gets up
We'll probably
crawling
have
towards
to
us,
do the whole
then as you
back.
go back to small, it'll slip down.
Okay,
Slip down easier.
just in case one runs up in my office.
You almost have to twist to get it out sometimes.
Yep.
Is that-
Since he's just gonna
Yeah,
be
that's normal.
for a little bit, I'm gonna go try and sneak cover the last two.
Okay.
Before I just don't lose that.
And then make sure,
Okay.
it's a non-initiative.
Okay.
Who's just send me a picture of my phone. So that's nice.
Oh man, this would kill me.
Would you? Now
Yes,
I'm
sir.
starting to do root canals on these things.
Well, he was saying it's a lot easier with the smaller one. Because it's like, you have power tools, you're using most of them, right?
Yeah, that rotary system.
Yeah.
I mean, that makes it real nice.
It's like the gripping of these, that's what hurts.
Yeah. Just trying to hold on to that.
Yeah.
Do you guys still have a good view from the Explore
If
camera?
we get the flush on, oh baby. That's awesome. Yeah, you go to the next one's 18 gauge. Look at that.
Because I think I am going to lose all power on my stabilizer here. So just want to make sure before I close this down.
Alright, keep going.
Keep going.
Keep going, Keith.
You can do it!
Yeah, when you flush, it definitely gets.
Does it make a difference?
Yeah.
Yeah.
Okay, good deal. Thanks, Deb.
It's small, but it's noticeable.
If you notice any of the flush coming out, just catch it.
Alright guys, well thank you very, very much for hanging out with us for the last 2 hours. I'm probably going to lose my stabilizer here, so I will direct all of you guys to the Explore camera. If you go to bigcatcams.com, find the Windsong Memorial Hospital camera.
If we get that next bigger cat there, it's 3.5 inches. That thing was all the way down.
And you guys can rewatch anything that you missed at dailybigcat.com. And a huge thank you to everybody who donated to help Kali with her medical costs today.
Oh man.
Gonna take some time with my girl real quick, and you guys can keep watching from the
It's
other
fine.
camera. So
Catherine,
thank you
know
guys
that.
very, very much.
Like that.
Yeah.
See you guys soon.
Vanilla?